Hello, Ms. Johnson. My name is Becca. I'm a nursing student today. I'm going to be performing a physical assessment. Looks like you're here for an annual physical.
I am.
Okay. Do you have any questions before we get started?
No.
No? Okay. I'm going to verbalize hand hygiene, and I'm going to close the curtain to provide patient privacy. First, I just want to start off with some health history questions. Do you have any past health diagnoses or issues?
No.
Okay. Are you currently taking any medications or have any allergies?
No allergies, and I just take a daily vitamin once a day, and then I'm also on the NUR ring for birth control.
Okay. Do you smoke or use tobacco?
No.
Okay. And what would you say your daily nutrition intake would be?
Probably like 1,800 to 2,000 calories a day.
Do you exercise daily, or how many times a week?
I would say like 5 to 6 days a week, probably.
Okay. All right. Very good. Can you tell me your first and last name?
Yep, Caitlin Johnson.
Okay. And today's date?
August 9th.
Okay. And do you know where you're at?
Yes, at the hospital to get a physical today.
Okay. And who is the President of the United States?
Donald Trump is.
Okay. Are you having any pain today or have any recently?
No, I haven't felt any pain.
Okay. On a scale of 0 to 10, 0 being no pain and 10 being severe, what would you say your pain rate is?
Out of 0.
Okay. Perfect. Patient is well groomed, no acute distress. She is alert, oriented, ×3 because she knows where she's at, the date, and the President of the United States. She's sitting comfortably and denies any pain on a scale of 1 to 10. Her neurological are WNL. All right. Okay, I'm going to perform a skin assessment. Have you noticed any new lesions, rashes, moles of concern, anything on that?
No, not recently.
Okay. I'm going to inspect the skin, make sure that it's pink in color, and it is. Skin is warm and dry, and next I'm going to check the skin turgor, and her skin is elastic and recoils back to normal position. Okay, next I'm going to do face and head assessment. Have you had any frequent headaches recently?
I have not.
No? Okay. So initial inspection, I'm just going to look at her head and face. Don't see any noticeable rashes or lesions. Her hair is free of nits. Her head is normal cephalic, atraumatic, and symmetrical bilaterally. And then have you had any new lumps or bumps on your head?
Not that I know of, no.
Okay. All right. To palpate. Any tenderness while I'm doing this? Okay. So no tenderness noted with palpation. And next I'm going to test the cranial nerves. I'm going to have you frown, smile, and puff your cheeks out for me. Okay. This is testing the cranial nerve 7, which is the facial nerve. And then I'm going to ask her to raise her eyes. Okay. And this is going to test the cranial nerve 3, which is the ocular motor nerve. Lastly, I'll have you stick your tongue out for me. Can you say ah?
Ah.
Okay. And I'll have you move your tongue around outside. Okay, and then this is going to test the cranial nerve 12, which is the hypoglossal. Next, we're gonna move to the eyes. Do you wear any contacts or glasses?
I wear both. Right now I'm wearing my glasses, but I usually wear daily contacts.
Okay, have you noticed any changes in your vision?
No.
Okay. Upon inspection, eyes are symmetrical and both pupils are round and equal. Sclera is white. So I'm gonna test for her EOM. I'm just gonna have you just stare at my pen, and then without moving your head, just moving with your eyes, just follow that. Okay. EOMs are intact. Next, and the last step you always do is to test the perla with light. So I'm just gonna have you follow this light as I go toward you. Perfect. All right, pupils are equally round and reactive to light. Okay, next I'm gonna do the assessment of the ear. Have you had any trouble with hearing loss?
No.
Okay. I'm just gonna assess the outside ear. Doesn't appear to have any drainage, and no skin breakdown behind the ear. And then I'm just gonna touch your ear. Is that okay?
That's okay.
Okay. Just gonna palpate around the external ear. Any tenderness there? Okay. And then bilaterally, we check the tragus palpation, Any tenderness when I do that?
Mm-mm.
Okay, no tenderness on palpation of tragus or external, internal, or anterior ear. And then next we're gonna test for hearing loss. So I'm just gonna have you cover one of your ears and let me know if you can hear that.
Mm-hmm.
Okay, and then I'm gonna have you cover the other ear.
Mm-hmm.
Okay. Patient notes hearing fingers rubbed together bilaterally. Next we're gonna test your nose. Have you had any trouble like with smelling or anything?
No.
Any difficulty breathing?
No.
Okay. So first we're just gonna have you cover one nostril and then breathe in and out. And the other one. Any difficulty on either side?
No.
Okay. Patient's nares are patent. Okay, now I'm going to do the neck assessment. Do you have any limitations or pain in your neck right now or recently?
No.
No? Okay. First, we're going to locate the cervical lymph nodes and palpate. So, palpate those. No lymph nodes are palpable. And then next, I'm going to locate and palpate the carotid arteries, doing this one at a time, but both sides. Then, so first, locate the carotid artery, palpate, and using the bell of my stethoscope, I'm going to instruct the patient to hold her breath, but also holding mine, so I remember to tell the patient to breathe out. And hold your breath for me. Okay. And you would do that on both sides. I'm trying to breathe out, sorry. Breathe out.
Okay.
And then you'll do that on both sides, and there was no bruits auscultated. Then next you're going to just find the trachea and palpate that. Trachea is midline. Okay, next I'm gonna do upper extremity assessment. Have you had any joint pain recently?
No.
No? Okay. First I'm gonna inspect the arm, just making sure that there's no swelling, lesions, lacerations. We don't have any of those noted, and then her bone length looks symmetrical and muscle mass is symmetrical. Next, I'm gonna palpate her joints. Is there any tenderness while I do this?
Mm-mm.
Okay. And then I'm going to locate and palpate the radial and brachial pulse. So just thumb side would be the radial at the wrist, and then brachial is at the elbow joint. Heart rate or regular rate and rhythm for those pulses. And then next we're gonna check capillary refill. And capillary refill is less than 2 to 3 seconds. Next we're going to demonstrate range of motion. So first I'm just gonna have you hold out your arm for me. And I'm gonna have you bring it up towards your shoulder and back down. That was flexion and then extension. And then I'm gonna have you turn your palm face down. This is pronation, and then back up would be supination. And then have you put your arm down, raise it up for me. This is gonna be abduction. And then I'm gonna have you place your hand behind your neck. Okay, external rotation. And then I'm gonna have you bring your hand back down to your side. And then I'm gonna have you make a, which would be abduction, and then have you make a chicken wing, and that's gonna show the external rotation. And then muscle strength is 5 out of 5 bilateral and symmetrical. Full range of motion is noted in the upper extremities. Okay, next I'm gonna do the pulmonary assessment. Have you had any shortness of breath, coughing?
No.
Any difficulty breathing?
Mm-mm.
Okay, I'm gonna observe her respirations as she breathes for about 1 minute. So then her rhythm is regular, her breathing appears quiet. It's within normal limits, which would be 12 to 20 breaths per minute. Next, I'm gonna auscultate for lung sounds. Bilaterally at the second intercostal space. Have you breathe in and out, and in and out. Okay. Lungs sound clear. Next, my stethoscope is backwards.
You're okay.
Dang it. All right. Next, we're gonna move to the posterior side, starting at the apices of the lung. which is above the scapula. Breathe in and out. Then you're going to move to the point 4, which the 4 point, which is the middle lobes. Doing both sides here. All right, no crackles, wheezes, or rhonchi are noted. Next, we're going to move to the cardiovascular. Have you had any chest pain?
No.
Recently? Okay. All right, so I'm going to auscultate and verbalize where I'm placing my stethoscope. First, we're going to start on the right side. Second intercostal space, this is the aortic. And we're going to move over to the left side, still at the second intercostal space. This is the pulmonic. We're going to move down to the third, which is Erb's point. And we're going down to the fourth, which is the tricuspid. And then fifth, mid-clavicular, is going to be your mitral. Just noting on the S1 and S2, S1 is going to be the closure of the mitral valve, and which is the lub sound, and then S2 is going to be our dub sound, closure of the aortic and the pulmonic valves. Heart rate and rhythm were regular. Okay, now I'm going to move on to the abdomen, and what I would do here is, have you had any recent changes in your bowel movements?
I have not.
Okay, I'm going to demonstrate the 4 quadrants of the abdomen. We have the right upper, left lower, and right lower. Then I'm going to move on to the palpation part. Start with a light palpation, which is usually about 1 to 2 centimeters. And I would have her lie back on an exam table if I had that. Right now we're just going to do it sitting up. So, any tenderness there? No tenderness noted with the light palpation. I'm going to move to the deep palpation, which is 4 to 6 centimeters. Any tenderness while I do that? All right, and no tenderness noted on the deep palpation. Moving on to the lower extremity, I'm going to first ask, do you have any pain or swelling in your legs?
No, not recently.
Okay. No edema present upon inspection. I don't see any moles or lacerations of concern. And then we're going to identify the popliteal pulse, which is going to be behind the knee. I'm going to palpate that. And then next we're going to do the posterior tibial. It's located behind the malleolus and in front of the Achilles tendon. And then the dorsalis pedis, which is on the top of the foot. Just going to palpate that there. I didn't find anything concerning with the exam today. Thank you for letting me perform my physical assessment on you.
You're welcome.
And then I would perform hand hygiene, and we're all done.